I want to thank the Smile Train and the organizers of this program for giving me an opportunity to be a part of this. The topic we are examining this morning says socio-cultural issues relating to surgery and post-surgery speech therapy of cleft patients. And it will go this way. The outline, we have definition of terms, culture and society, surgery, social and cultural issues that relate to surgery, consequences of these issues, post-surgery speech therapy, issues for therapies, role of the SMILE train, and then conclusion. So for definition of terms, social society or its organization. Hello, I hope I'm still being heard. Hello? 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 Hello?
Please proceed, we can hear
Hello?
you.
The call was coming.
Please proceed,
Hello?
we can hear you, Grace. Please
Okay,
proceed.
all right, thank you. Social, relating to society or its organization, needing companionship and therefore best suited to living in communities. We always know that humans are pack animals. We never live alone. We are always interacting in the society. Cultural is our way of life, relating to habits, traditions, beliefs of a society. Issue, an important topic or problem for debate or discussion. Then surgery is a branch of medical science that treats injuries, diseases, deformities by the physical removal, repair, or Then speech therapy, as we know, is training to help people with speech and language problems to speak more clearly. So we go on to culture and society. A culture represents the beliefs and practices of a group of people, while society represents the people themselves who share those beliefs and their practices. And we know that neither society nor culture could exist without the other. They are interwoven. Before the advent of modern medicine, Africans have always found traditional ways to treat their ailments. They have the herbalists, people you call the herbalists, and those who also use spirits to cure ailments. I remember there are ways of doing orthopedic cases whereby they take a chicken, they break the leg of the chicken, and they apply person who has an injury or a broken bone, and as the chicken is healing, the person also is healing. So there are various ways that Africans have always treated their own ailments. And physical appearance is very important to human beings. We are judged by the way society has determined that we look. Appearance also determines the social treatment of children. You know, when a child is pretty, you want to interact, and if it's otherwise, they don't get, people to play with. Little wonder that plastic surgery was the form of surgery practice as early as 600 BC, by humans because of the premium praise placed on look. Surgery. Surgery or operation, as it is sometimes referred to, it also means to go under the knife. That's the slogan in America, go under the knife. Surgery is known in different languages. In Hausa, it's theater, Iwahu in Igbo, Ishe Abe in Yoruba, Operation in French, and Cirugía in Spanish. The word surgery brings different images to different persons. I have my own experience. Contemporary culture still associates surgery with a lot of myths, superstition, and diabolic practices. For example, some people are of the belief that informing people that you are going for surgery could result in ill luck. So you have family members who will go for surgery and they'll never inform you until the surgery is successful before they can disclose it, because they believe that informing people might invite things that are not negative, the negative environment, to their surgery. So they prefer to keep it secret. And this is part of the reason why some people would not even want to go for surgery, because so much is attached to it. So let's go to the social and cultural issues relating to surgery. Every society have what they believe in. They have a deity they worship. And these religious beliefs plays key role in determining whether a person with cleft palate or even any other ailment at that will seek treatment. And it also determines the extent to the treatment they are willing to take when they eventually go to the medical facilities. For instance, there are those who believe that cleft palate is a punishment from the gods. And if God is punishing this person for this ailment, then they think they don't have a hand in seeking a solution. So they will not want to take the child for treatment. And then those who believe that they shouldn't take the blood of another human being, they reject blood transfusion. And since the surgery for cleft lip and palate will most often involve blood transfusion, so they will not want to take it. And then there are some group of Christians who believe in the efficacy of prayers, that solutions can be gotten to medical issues through divine intervention. So they would rather want to have God do that for them. So language is another very important issue that contributes to either a person accepting or rejecting surgery. Like if there's a language barrier between the physician and the client or caregiver of the client, there could be a breakdown in communication whereby the physician is intending something and the client is being given another thing. So you can imagine when a person gets to the hospital and you get an interpreter and say, we are going to operate your child, and the person interpreting says, we are going to cut your child. And that person would rather want to go back home and not accept, the treatment. Then there are cultural practices that locate decision making in some group of persons other than the caregiver or the patient, him or herself. Like in the African society, most often you find that it's the men that have to take the decision, or the eldest person in the family. And apart from the fact that the bureaucracy delays the decision taking, this person might not be well informed about what surgery is going to do. And so the person might want to say, no, in our family, we don't go to the hospital. In our family, we don't take injections. We don't submit to surgery. I know of a case of a man that said in their family, they never take injections. And truly, when they got to the hospital, they tried to apply injections. The needle didn't even go through the body. So there are different cultural practices that could prevent people from accepting to undergo surgery for children with cleft lip and palate. There are superstitions, there are fears. What you don't know about, you'll be afraid of. I myself have my fears about surgery, and there are other people who have their fears and superstition attached to this fear. Maybe a member of the family has gone for surgery before and something happened, and they want to link that to this child to say, no, we will not take surgery. So hiding the child due to stigmatization is another practice. This child is born in the part, though I live in Lagos, there are so many in the lands, local villages, setups that have no direct access to medical centers. And so they have their deliveries in their homes or herbal homes. And when perchance a child is born with cleft lip or palate, they will hide this child successfully. They will never want to present the child, even when you want to offer help. And then there are also myths of demon possessed, the child is demon possessed, witchcraft, curse, mother worked late in night, maybe engaged in a fight during pregnancy, that's why I gave birth to this kind of child. So many things are linked up with this condition, and so hinders the parents from presenting the child, to have the best medical care, including surgery. Then I included infidelity in marriage because of the experience I had during the Smile Train broadcast, that we had to take posters to places to give to people. I happen to have given the posters out to teachers who are in schools, and this person brought a child to me. And the arrangement was, I'll take this child to the center where I work at the National Hospital, Orthopedic Hospital, and you'll be attended to. I had already told the surgeon that the child was coming. But the day before we were to come, I was trying to make arrangements to say, this is where I'll pick you up, to take you for to the hospital. And I tried to connect, I couldn't, and they never showed up. So I had to connect the teacher to ask what happened. And by the time she made her investigation, she discovered that this child actually did not belong to the father that it was presented to. The father was eager for the child to come for the surgery, but maybe because of guilty conscience, the mother knew she wasn't faithful. She had brought this pregnancy from another place to this man. And so that child was denied of surgery, because up till today, I never know what happened to that child eventually. That's why I put that, as infidelity in marriage could also disrupt a child from having surgery. Previous failed surgeries, like I mentioned before, the lack of awareness of services. Despite the attempts to create awareness about services, we still have a lot of people that are not aware of these services. So if they are not aware, there's no way how they can present the child to the centers where services can be given. And so if the child is not presented, it's losing out of the services. Consequences of these issues I have listed. If the child is not given surgery, especially for children.
Excuse me, Mrs. Ademola, could you kindly let me know when I should move to the other slide, please? Could you look at the slides I'm sharing and let me know when I need to move on, please? Thank you.
Okay. Okay, it's because it's so small, I'm not even saying it. All right, thank you. I'm on consequences of these issues now. Okay, so abandonment of the cleft palate child or delay in accessing service is one of the consequences. The child could be abandoned, like that child that I said the mother confessed to infidelity, and because of that, he couldn't have, we couldn't take her to the hospital anymore. That child, I'm sure, will be abandoned because the father will neglect, and then the mother might not even have the means to do the needful. So the child could be abandoned, or eventually, if they are to access service, maybe they'll be accessing service at a very late age, when the child is advanced in age, when he could have gotten the service at an early age. Then the death of the child. We know very well that children with cleft lip and palate have problems with feeding. And so this child, if he's not given surgery when he should, the child could be malnourished from not being well fed and could die as a result of malnourishment. Or some cases, the parents find a way of getting rid of this child. So the child could be, you just find that the child is dead one way or the other. They just say the child is dead. Then rejection. This child, if not given surgery, like we said, appearance matters in the society. People appraise you by the way that you look. And so if it's not given surgery, it could result in rejection from playmates and from people that should be interacting with. Stigmatization also. The child will be stigmatized. And then number 5, I put deportation. What I meant by deportation is the fact that most parents, especially if they live in the cities, will find a way of sending this child back to the village to go and live with the grandparents, just to remove, the child from their side, because to them, this child is an embarrassment. So those are the consequences of not giving the child surgery when needed. Next slide, please. Next slide, please. Okay, post-surgery speech therapy now. Like I said earlier on, speech therapy is to teach the child, to be able to speak properly. So, and it's a very important aspect of the management of cleft lip and palate. A newly constructed palate after surgery. And the only way he can learn to do this is by having therapy. And therapy is time consuming because the child and the parents will have to visit the hospital after the surgery. So the therapist will work with the client to achieve, learning to establish correct articulation, which involves the use of the tongue, the lips, the teeth to pronounce, to produce recognizable sounds. Because prior to this surgery, the child has been the speech therapist to assist the child now to learn the correct placement for her sounds. Also to help to establish new motor speech pattern that replaces sound errors. Like I said, follow-up visits to check on hearing. Children with cleft lip and palate often come with hearing issues. So we need to also be aware to find out and ensure that the child is hearing properly to be able to benefit from speech therapy. And how well the child is able to learn speech and use the same determines how well and fast he or she will be reintegrated into the society. Because the society would accept this child, especially in the school, if he can participate in class activities, speak out correctly, or else there might be issues of making the child to be looking neglected in class. Nobody wants to call upon him or her to answer questions. So the speech therapist needs to play this role. Factors abide that hinder the smooth playing of this role of the speech therapist. Okay? We find that most often the child is not able to keep up with speech therapy appointments because the mother who has been working alone, first of all, to take this child for surgery if they eventually have surgery, and then it's still the same mother who is supposed to bring the child to the hospital for speech therapy follow-up from time to time. And so because she may have neglected her business while the child was in hospital for surgery or preparing for surgery, she will want to make up. And even those who work in government establishments, they still have the issue of my boss is not giving me time to come for speech therapy. They are complaining about my taking off time from the office too often. So lack of time affects the frequency of therapy sessions. So instead of maybe having twice a week, you may have once a week or once in 2 weeks because of time. Another factor that hinders frequency of attendance of speech therapy is finance, payment for transportation, to the clinic. I've personally had experience of having to give someone money to travel back to where they came from to attend therapy because he ran out of money to be able to, transport himself back to base. So parents lack finance to be able to follow up for speech therapy. The lack of family support. Like I said, this woman is often left alone with this child. I have had cases where I sent for the husband, Hello, I hope you're still hearing me. Hello?
Yes, please carry on. We're hearing you.
Hello?
Hello, Ademola, we're hearing you. Please, can you carry on?
All right then. So, lack of family support. I have had occasions to send for some fathers, just to plead with them to help out with the child coming for speech therapy because the mother is just left alone to do all these things by themselves. So the family needs to support, the mother and also the child to be able to benefit adequately from speech therapy. Then stigmatization, even though there is gradual reduction in social stigmatization because of awareness being created gradually, the child with cleft palate still face mild form of stigmatization in the sense that they have playmates who don't want to play with them, or if they play with them, they mimic them, the way they speak, and most often maybe it will end up in fights if the child can stand up to fight. So they do not have many playmates. They have fewer opportunities to practice the speaking they are supposed to practice. Like when they are learning a speech therapy, they are supposed to go out there and be able to put to practice sounds that they have learned, syllables that they have learned. And when there's no one to talk to, it will be difficult. So the assignment they are given, they are not able to practice at home. Next slide, please. Then for the therapies, as a speech language therapists working in Nigeria, we most often do not have international sponsorship. Like the government doesn't sponsor workers to go and attend courses abroad. And most often we have to use our money, which is costly. So the therapists need to be adequately equipped to meet the challenges of the modern day therapy requirements. Training and retraining of speech therapists is essential because the surgery, if successful, still needs the help of the speech therapist to be able to help this child to communicate effectively, adequately, learning the new sounds, like I said, being able to use the new palettes that have been created for them. So therapists need to be adequately equipped to be trained, and this training is not cheap. So I want to implore Smile Train to still think of how to help more therapists to get this specialization in cleft lip and palate management for speech therapy. A well-done surgery without salt or soup without meat. So for the surgery benefits to be maximized, the therapy needs to be at the top of their therapy delivery. Okay, role of Smile Train. Smile Train has played a vital role in making a difference in the lives of adults and children with cleft palates, especially in Nigeria, in the city where I live, Lagos. And I know other cities too have benefited greatly from the support of cleft palates, of Smile Train in helping children and even adults with cleft lip and palate, not only by providing free surgery, but surgery without deformity. When I say surgery without deformity, I know when this surgery first started, children ended up with another kind of deformity, as I'll put it. They had extra flap on the nose after the surgery, which was not good looking. And that was another attraction to the child. What happened? Why this extra flap? But by the advent of Smile Train, trained surgeons, and the surgery became more clean and presentable, that you even hardly know if this person has had a surgery. So Smile Train has played a very good role, and they are still doing that. And those who have benefited from these surgeries have been spreading the good news, both in Nigeria and abroad. However, there is still need to do more publicity. as people in the rural areas are yet to be adequately reached. Like I said, I live in Lagos State, which was the former capital of Nigeria, but we still have rural dwellers that are not getting into this program because of the gap in communication. Like I said, a lot still give birth in their homes because there are no medical centers. And maybe because of the light situation, people hardly have the benefits of listening to radios, televisions, and even using the social media because of the cost of data most often is still, the use is still limited. So I still don't know how Smart Train can still make the publicity more, to be able to reach the unreached. I was suggesting bulk short messages and other methods of broadcast, maybe radio jingles, television jingles, I don't know, so many other ways, word of mouth to people. Like when we carry those posters to the rural areas, the people were able to get that information, but that was just at that period. Maybe we should still continue spreading those posters and telling people about the surgery. I know some have come to our center and I will ask, how did you know about this center? And they will say they were queuing up at another center. And one of them came over to our center to have their own surgery done. And that person invited them to tell them, there's no queue here. Why don't you come over to this place? So gradually, as we move on, I know that things will get much better. Next slide, please. Yeah, this last slide is the conclusion. And I'll conclude with the quote of Robert Schuller, who says, problems are not stop signs, they are just guidelines. So whatever problems we are encountering now, they are guidelines to lead us to more paths where we could be more support and of more help to the people we cleft lip and palate. The last slide, please. Thank you for listening. I appreciate you.
Well, thank you very much, Mrs. Ademola Chukoya. We appreciate the effort you have put into this paper and also the way the paper has been delivered. Let me say to our friends who have joined us, I think we have about 58. Please, can you hear me?
Yes.
Hello?
Hello?
Please, can you hear me? Hello, Mrs. Ademola, please. The rest of us, can you please hear me?
Hello, I can hear you.
Yeah.
I can hear you.
Thank you very much. First, I've been trying to say thank you very much for a paper well developed and well delivered. And we also want to emphasize the fact that, hello?
Hello? Hello?
Okay. Yeah. Thank you very much. I'm trying to say that the beauty of this paper, of course, has brought out the fact that there is much more involved in cleft surgery and speech therapy for patients who have cleft problems. It's not just matter of surgery, it's not just matter of therapy. There are so many things that are still involved, particularly the socio-cultural matters, the issues which you have delved into. African crime is a different kind compared to other developed crimes. We still have some practices, some cultural practices, we still have some socio-cultural practices which must be addressed if we are to have expected success in surgery and speech therapy for patients who have cleft palate. When we have bodies like Smart Train and other organizations that have been involved in carrying out surgery and also implementing therapy, speech therapy after surgery. We thought within a matter of time, almost everybody, every Nigerian, every African with cleft lip or cleft palate will submit himself or herself for surgery, and in a matter of time, we will have less or no more person with cleft lip or cleft palate. But that hasn't been the issue. We have difficulty in having the patients coming forth, even when surgery is free and speech therapy doesn't cost much money. So there are some social cultural issues. You know, the issue on the sociology of surgery as well as surgery as well as speech therapy after the surgery. So that is where I think the beauty of your paper is. And while we are waiting for our colleagues to please come up with questions and for question and answer time, let me quickly also recap what you have said. You have told us some things that are very important as far as culture and the society is concerned. In African settings, we still have fear surrounding surgery. People have a lot of fear. They entertain a lot of fear. Many will not want to go for surgery. Okay, we have the issue of the blood transfusion. Many will not want to share blood of other people. The problem of interpreting. You have the parents who are not literate, and again, the medical personnel who are literate. So somebody stands between two of them trying to interpret it, to interpret what is said in English. But unfortunately, at the delivery level, the interpretation, get a mess. And the message that is interpreted to the child and the parents could be very horrific, that parents or the child may decide it's better they go on with their cleft problems rather than to submit themselves, for surgery. Marital issues, and again, stigma, stigmatization. Those are some of the issues having to do with surgery problems. Let me also clearly put it in context that your paper addressed two major areas, surgery and also post-surgery. The post-surgery matter, this is where speech therapy, comes out. You have also tried to let us know the need for speech therapy. In essence, it's not just a matter of, bridging the gap existing in the lip or the palate, or making the patient look now cosmetically okay. But there is also a need to correct the speech problem which emanated from the cleft. And you also mentioned those areas the speech therapist must capitalize on, concentrate on. The problems that are usually involved, for instance, the time, the finance, and also the family support. You have mentioned those things. But then let me also add that there is still also a socio-cultural problem, as regards to speech therapy. We have also had so many patients who went through surgery, but never submitted for speech therapy after the surgery. So the question is, what is the problem? Again, socio-cultural issue. In Africa, we lay less emphasis on the way we speak. Many believe that as long as the corrections have been made, no more gap, no more stigma, all has been accomplished. How a child or how an adult speaks is not a problem. So it's still a sociocultural problem. That is one of the reasons why we have so many patients after surgery who will not come, who will not even come for speech therapy. And some may even start, just also as part of the reasons you have mentioned, they may abandon the therapy. So thank you very much. I think we need to go now. We need to go now to look at some of the questions and how we are going to attend to the questions. Okay. Like I've mentioned, we have about 58. Now we are 60 participants in this program. That is quite very encouraging. We appreciate you all. Now, most of the things I am seeing here at the chat, they are rather commendations, okay? Like we have had the other moderator, Uba, who has stated that we should please submit a question, for question and answer box. Again, Chizuma will stay weekly, to every one of us. Thank you for highlighting the social challenges peculiar to our environment. Thank you very much. Again, we have another commendation coming from Edna Kaganjo to all. Kudos. I think she meant kudos, but what I'm reading here is queridos, participants. Okay. Oh, sorry. Probably this French or Latin. I think the interpreter will do better to interpret that. I'm sorry. So please, ladies and gentlemen, we are waiting for questions. Good enough, like I've mentioned. Our speaker today is a rare breed, one of frontline speech language therapists in Nigeria. As I've mentioned earlier, she has a very rich resume. She's a member of both local and international associations of speech language therapists or pathologists. And again, she has put over 30 years of practice. She is the director of the speech department, the National Orthopedic Hospital in Lagos, former capital of Nigeria. And she's still quite very active. You can see her quite very active. We still believe we can have her for the next 30 years, making 60 years altogether. After that, we may determine whether she will retire or not. Okay, I think there is one question here.
The Q&A.
Okay, thank you very much. This is coming from Obadi, from Democratic Republic of Congo. That's wonderful. Thank you for your presentation. What do you have as a strategy to increase the number of patients who need to come for review? Have you found a sociological issue in not coming for review, even for surgery? And please, our lecturer, did you hear me? Or you want me to repeat the question?
I think I heard you asking what I'm doing to get more clients on board.
Yes.
Okay. I know the smart train work is not a thing, it's a group work. And right now, Hello?
Hello.
Okay.
Ms. Ademola Sokoya.
Yes, can I carry on?
Yes, please.
I said the work is not one person's work, it's a group work. And right now at our center, things have not been as active as it was when we first started. When we first started, we were always going out, picking up
Hello?
Did you hear that?
No, I didn't. Can you please repeat? We have problem hearing the last part of your statement. Hello?
Okay, I said right here in the center where are you hearing?
Please,
right here in the center where I work. Okay, the group activity has not been so active as it was at the initial stage when we got those people down. So it's the coordinator of the group that needs to really step up things so that we can go out once again and then keep the publicity going, even if we are not going out as we used to do because of the situation in the country. I think the Hello?
Hello?
Yeah, did you hear? Did you get me?
Yes, we got you.
I think there are so many microphones on.
Okay,
So many.
please can I plead with us all? Some of us, if you are not speaking, can you please mute yourself so that we can hear the lecturer clearly or clearly better? Okay, please, thank you very much. But let me also ask a question while we are waiting for others to please post their questions.
Okay.
Actually, the matter we are discussing today goes beyond speech therapy as a profession. It involves a lot of specialists and other fields. Like I've mentioned, it's a sociology matter. You know, the sociology of cleft surgery as well as cleft speech therapy. There is a need, for instance, to bring in sociologists. There is also a need to even bring in our colleagues who are surgeons, because having gone through your lecture, you have mentioned many reasons why patients or parents will not submit themselves or their children, you know, for surgery. So what can we do for adventure in terms of interdisciplinary approach, you know, evolving a better and a stronger interdisciplinary approach as addressing the socio-cultural challenges which are working against both surgery and also the speech therapy, you know, that is needed after the surgery.
Well, what comes to mind as you are speaking is the method, the people that go, is it the primary health caregivers that go for immunization? Apart from the fact that, let me first say that it's a teamwork here. The surgeons are involved in this trying to get people to come for surgery. The social worker is there. The medical social worker is there to also be part, so that when people have financial issues, I didn't mention that there are sometimes that even the medical social worker will have to help to get finance for those who have issues with transportation. We've had to do that for some that we really see that they are very poor, they can't afford. But what came to mind as you were speaking is using the method of the primary health caregivers who go for immunization. They go to the community for sensitization. They contact the village head or the community head, the community development association leaders. They are invited for this awareness, and they are thoroughly educated so that, like I said in my presentation, the elders in the society, they contribute greatly to encouraging either for children to have surgery or not. So to get them to be able to make positive decisions for their family members or even people around them, if they are educated through this means, village gathering and disseminating information of the benefits of surgery for this case especially, I think that will go a long way.
Okay, thank you very much, our lecturer. Let me also, in addition to those wonderful points you have mentioned, we may also as well suggest to the SMILE team to consider bringing on board the medical sociologists. I think their efforts are also needed, you know, in helping us to understand how do we reach out to greater parts of our populace and finding out the people who need to come for surgery and also speech therapy. I do not have data as per how many people are there that we have reached and how many people are yet to be reached. But going by what you have said and also the available literature, Africans are fond of hiding people who have deformities. You know, they can even hide themselves. I'm sorry, they can hide them in the inner part of their houses, even when they live in city like Lagos where you are. But like you have also mentioned, the possibility of even sending those children, if they happen to be in the city, the possibility of sending them to the remote, you know, the village, the farther places, you know, is also there. But then the fact remains that as laudable as all efforts put together to correct cleft lips, cleft palates, and also to improve the speech of the patient, as laudable as these efforts are, the fact remains that if we do not get as many who need to benefit from this program, it's like we may not be able to do enough. So there is still that need, like getting more professionals involved. Like I've mentioned, the medical sociologists, for instance, there are so many cultural and socio-cultural issues that must be unraveled, as far as this effort is concerned. Thank you very much. Let's see. Oh, hello, are people? Anyway, I think your lecture is quite very comprehensive. Maybe you have dealt with so many issues that there are hardly any questions being raised.